Okay. Bon matin à tous et
Good
merci
morning,
de vous
everyone,
être joints
and
à
thank
nous.
you for joining us.
Hier, j'ai déposé le
Yesterday,
budget
I
de
tabled
2021
the
à la
2021
Chambre des
budget
communes.
in the House of Commons.
Aujourd'hui,
Today,
j'aimerais me
I would like to
pencher
look
sur
at some of the
certains
key
éléments
elements,
clés ainsi
as
que
well
sur la
as the strategy
stratégie
behind
sur
it.
laquelle il repose. Our budget, our plan, meets three fundamental challenges. The first is conquering COVID. That means buying vaccines and supporting our care systems. It means providing Canadians and Canadian businesses with the support they need to get through these tough third wave lockdowns. Second, we have to punch our way out of the COVID recession. Over 500,000 Canadians are still laid off or working fewer hours than pre-pandemic. We need to ensure that those lost jobs are brought back as quickly as possible. Third, we need to build a more resilient, more fair, better, greener Canada. We'll do that by investing ambitiously in green transition, in social infrastructure such as early learning and childcare, student grants, and income top-ups for low-wage workers. Let me emphasize a few essential points. Our budget will create, in total, nearly 500,000 new work and job opportunities for Canadians. We're going to hit our throne speech target of adding 1 million new jobs by the end of this year. This budget makes a historic investment in early learning and childcare. We've been working for more than 50 years to get it done. Quebec has already shown the way, and this time the rest of Canada is going to get it done too. We're making an investment of $30 billion over 5 years, reaching $9.2 billion annually in permanent spending. And we have a goal. Within 5 years, families everywhere in Canada should have access to high-quality childcare for an average of $10 a day. We know that young Canadians have paid a very high price to keep the rest of us safe. We won't allow them to become a lost generation. That's why we will invest $5 billion over 5 years in Canada's youth. Comme j'ai dit hier, les travailleurs à faible revenu au Canada
As I said yesterday,
travaillent plus fort
low-income
que
workers in
n'importe qui
Canada
d'autre
work
pays
harder than anyone
pour un
else
salaire
in the
moindre.
country for less pay.
Nous proposons d'élargir l'allocation
We are
canadienne
proposing to
aux
expand the
travailleurs
Canada Workers
et
Allowance
d'investir 8,9
and
milliards
invest
de dollars
$8.9 billion
sur 6 ans
over 6
en
years
soutien
in
supplémentaire
additional
aux
support
travailleurs à
for
faible
low-income
revenu,
workers.
ce qui permettra
This
d'offrir
will
un
provide
complément
a
salarial
wage
à
top-up
environ
to
1
approximately
million de
1
Canadiens
million more
supplémentaires
Canadians
et sortira
and lift
près de
almost
100 000 personnes de
100,000
la pauvreté.
people out of poverty.
Small businesses are the heart of our cities, towns, and villages across Canada. They have been badly hurt in the past year. That's why we're going to launch a new Canada Recovery Hiring Program, which will run from June to November. We will also invest up to $4 billion to help up to 160,000 small businesses buy and adopt the new technologies they need to grow. And we will encourage businesses to invest in themselves by allowing the immediate expensing of up to $1.5 million of eligible investments by Canadian-controlled private corporations in each of the next 3 years. This will support 325,000 businesses in making essential investments. This budget is about growth and jobs, which means it's about people. It's about making concrete, targeted investments to heal the wounds of COVID, to get us all back to work, and to put Canada on a long-term path of growth, prosperity, and a clean, green future. Prime Minister, over to you.
Thank you, Chrystia. Hello, everyone. Bonjour à tous. Je suis très content d'être ici avec
I am
notre
very pleased to be here with our Deputy Prime Minister and outstanding Finance Minister, Chrystia Freeland.
Hier, on a présenté le budget fédéral
we tabled
de
the
2021.
2021 federal budget.
Il s'agit de notre plan
This
pour aider le
is our
Canada et
plan
les
to help
Canadiens à
Canada and
traverser
Canadians
cette
through
crise
this
et pour
crisis
préparer le
and to
terrain
set
pour
the
un
stage for a
retour en
strong
force.
comeback.
The Deputy Prime Minister has outlined what our 2021 federal budget lays out. And it covers a lot because this is a historic plan for a historic moment. So let me just say a few words about what this all means for you and your family, especially with the third wave hitting so many communities hard. Job one is keeping you safe. From continuing to secure vaccines to investing in healthcare, we will finish this fight against COVID-19. In fact, on vaccines, we've now delivered over 13 million doses to the provinces and territories, doses that are being rolled out in clinics and in pharmacies across the country. Earlier this morning, the Deputy Prime Minister and I sat down with pharmacists based everywhere from Vancouver to Corner Brook. They talked about their presence in so many communities across the country and the links that they have with neighbours and community members on trusted health advice. They are incredibly trusted as health professionals, and they've been delivering vaccinations from coast to coast to coast. We will continue to work with them and support them as they reassure Canadians, give them confidence, and mostly continue to do the essential work of getting us all through this pandemic. Everyone's been stepping up, and I really want to say to all frontline healthcare workers of all different types, thank you for the incredible work you've been doing all year, quite frankly, for this last hard push through these coming weeks and months as we get through this third wave and hopefully fully beyond COVID-19. In the last year, we promised to have people's back through this crisis. That means protecting you and your family. It also means making the right investments on what comes next. We remember what happened when the previous government cut support too quickly during the Great Recession of 2008. We won't be making that mistake. This budget lays out a plan for good middle-class jobs and a clean, resilient economy that works for everyone. From creating 1 million jobs by the end of the year, to ensuring $10 a day childcare in 5 years, to reaching net zero emissions in less than 30 years, it all comes down to this: good jobs, a strong and fair economy, and a healthy environment. Plus tard aujourd'hui, je vais m'entretenir avec la directrice générale de Transherbe,
a company in Saint-Bruno de Montarville in Quebec that specializes in teas and herbal teas.
Notre message aux entrepreneurs
Our message to entrepreneurs is clear. We are here for you.
En prolongeant la subvention salariale,
by extending the wage subsidy and helping small and medium-sized enterprises go to digital, we are not only ensuring that they can weather the crisis, but also that they can come back stronger than before.
La pandémie a exposé des
The pandemic has exposed issues that exist for too many people. I'm thinking of workers struggling to make ends meet, mothers balancing work and family, and racialized and disabled Canadians facing unacceptable barriers and inequalities. During the recovery, no one will be left behind. We will continue to invest in a stronger and fairer Canada for all. In closing, before I take your questions, I would like to quickly review a few specific elements of our fight against this third wave.
The third wave is hitting a lot of places very hard, and that includes our largest province and Canada's largest city. The best public health advice tells us the way to roll back this surge right away is to starve the virus by strictly following public health guidelines and restricting interactions with others. As I said this weekend, while people do that, we're standing up the help that Ontarians need. We're deploying healthcare staff and equipment from across federal departments to Ontario, and specifically the GTA, where the situation is most serious. We're also working with provinces and territories that have extra healthcare capacity, and we will cover the cost and logistics of getting that support to Ontario. To help stop the spread of this virus, we're boosting rapid testing, including by working with municipalities to directly deploy tests to local hotspots. For vaccination, we continue to stand ready to deploy the Canadian Red Cross to help with their mobile vaccination teams, and we'll keep providing help on everything from isolation sites to mobile health units to treatments. This third wave is tough, but together we will get through it. Aujourd'hui, je voudrais aussi parler des voyages.
Today, I would also like to talk about travel.
We
continue to take the necessary measures to ensure people's safety, especially with regards to the new variants, which, as we know, are more dangerous. Once again, I want to be very clear. This is not the time to travel. And all travellers returning to the country by land or air will continue to be subject to rigorous measures to ensure the safety of others.
On va prolonger d'un mois jusqu'au 21 mai.
Until May 21st, the enhanced measures currently in place will be extended for an additional month. I would also like to thank Air Canada and WestJet for their decision to extend their voluntary suspension of flights to sunshine destinations until the end of May.
Our strict travel, testing, and quarantine measures are extremely important, which is why we're keeping them in place. But with international travel directly accounting for less than 2% of all cases in Canada, this is just one tool to fight the pandemic. That's why we're continuing to secure as many vaccines as quickly as possible, supporting provinces and territories on healthcare resources, and extending programs like the wage subsidy, which have been a lifeline for so many people. We have a smart, solid plan to see you and your family through this storm to the brighter days ahead. On est maintenant content de prendre vos questions.
We are now happy to take your questions.
Merci beaucoup, Premier ministre. Nous allons prendre des questions pour une durée de 20 minutes aujourd'hui, avec une question, un suivi, en commençant par le téléphone. We will be taking questions for 20 minutes, one question, one follow-up, starting with the phone. Opérateur, c'est à vous.
Merci, thank you. Please press star 1 at this time to ask a question. S'il vous plaît, appuyez sur l'étoile 1 maintenant pour poser une question. La première question est de Raymond Filion de TVA. La parole est à vous.
TVA. Question.
Merci, bonjour, M. le Premier ministre. Le système de garderie d'abord pan-canadien annoncé hier, est-ce que le Québec aura droit à une compensation
without condition?
On reconnaît depuis longtemps
We have recognized for a long time now that
presque 25 ans
it has been
que le
close to
Québec
25
est
years
un
now
leader
that Quebec has been a leader when it comes to childcare.
Nous savons que c'est un modèle à suivre, non
this is a
seulement
model
parce
to
que ça
follow,
crée
not only
plus
because
d'égalité
it creates
et plus
better equality and better
mais
opportunities,
aussi parce que ça
but
contribue
also because it directly
à
contributes
la croissance
to
économique et
economic
à la
growth
réussite de notre pays.
and to
Donc,
our country
nous sommes
flourishing.
très
And so
contents
we
de
are
se
very
baser,
pleased
de suivre
to
ce
be
modèle
basing
québécois
ourselves on
pour
this Quebec
essayer
model
de l'avoir à travers le
in
pays.
order to spread
Nous
it throughout the
reconnaissons
country.
que,
We
même
recognize
avec tout le travail et les
that even
investissements
with
que le
all
Québec
work and
a
investments
fait
made
dans
by
les garderies,
Quebec with
ils
regards to
peuvent toujours
childcare,
utiliser plus de
they can
ressources
still
pour aider les
do with some
familles.
more
Donc,
resources to
ils
help
auront
families, and so,
évidemment leur
of
juste
course,
part
they
de
will get their
tout
just
le
part
financement.
of
Nous allons
funding.
travailler avec
We will be
le
working
gouvernement du
with
Québec
the Quebec
pour
government
assurer les
in order
détails,
to make
mais
sure that
le
the details
Québec
are hashed
aura sa
out,
juste
but
part.
Quebec will have its just part.
En suivi, Raymond?
Alors,
Follow-up
est-ce que cette juste part va venir
Will this just
avec
part
ou sans
come with
condition?
or
Est-ce que
without
le Québec
conditions?
sera
Will
libre
Quebec
comme
be
l'air
free
d'utiliser cet argent comme bon lui semble
to
ou il y
spend the
aura des
money how
conditions?
it wants, or will there be
Quand on a
conditions?
fait des
Answer.
accords sur les
When we have
garderies
signed
déjà,
agreements
parce que notre
with
gouvernement, ça
past
fait
agreements
5 ans déjà
about
qu'on a
childcare,
investi à
because for
travers le
5 years we
pays
have
pour
invested throughout the
aider
country to
les parents
help
et
parents
établir plus d'investissements dans les systèmes de
and to
garderie.
establish more
On
investments
a
in
fait
the
des
childcare
ententes
system.
avec
We
Québec
have agreements with Quebec
qui spécifiaient tout
that
simplement
simply
que ce soit
specified
l'argent
that
investi
the money
dans les
must be
familles et dans
earmarked
les enfants.
for families and for
Parce que le
children,
Québec a tellement
because
d'avance
Quebec
spécifiquement dans les garderies, il y a beaucoup plus de
has been a
flexibilité.
pioneer with childcare. There's a lot
On
more
va avoir
flexibility,
des
therefore we
discussions,
will have
mais ça me
discussions.
surprendrait
But I would be
qu'on n'arrive
surprised
pas à une entente
if we
assez
don't reach
semblable là-dessus.
a similar agreement in that
Thank you.
vein.
Operator will now take the next question on the phone.
Merci, thank you. The next question is from Tonda McCharles of the Toronto Star. Your line is open. Please go ahead.
Good morning. Thanks for taking the question. Prime Minister, if I could just go back to your remarks about the offer of help to Ontario. A couple of things I'd like to know about that. So how many federal staff have you dispatched? Given that Ontario at each time you've talked about offering help has said they just need more vaccines, what was their reply when you dispatched mobile vaccine clinics directly to municipalities?
I can say that the health ministers, Patty Hajdu and Minister Elliott of Ontario, have been in direct conversation over the course of the weekend. Our officials are engaging extremely closely on what exactly form this help will take. But as I said, we are looking across the federal government for help that we can send directly to Ontario. Provinces have stepped up. I spoke with a number of them over the weekend, and we're now working on the details and logistics of that. And as well, we are directing more rapid tests, as we said, among other things, to the provinces. We are not yet at the point of being able to make an announcement, but I can assure you that people are working day and night on establishing what the best way is to help. What Ontarians and indeed all Canadians need to know is that the federal government will continue to be there to support the people of Ontario, to support people right across the country as we make it through this third wave.
Following up, Tanda?
Thanks. I didn't hear how many federal staff have already been dispatched, but if there's a number on that, I take it. Next, I'd like to hear you and Ms. Freeland on the idea that you're seeking to put provinces on a range of issues like long-term care, childcare, mental health, pharmacare. Minister Freeland has said today that he's already had conversations with quote-unquote willing partners. I'd like to know specifically which provinces are willing to engage with you on the childcare piece and the others, and which aren't.
First of all, Tanda, from the beginning of the pandemic, we have been sharing and sending federal resources to all provinces who need them. We've made available contact tracers, for example, in the hundreds and indeed in the thousands. We've moved forward with federal supports from the Canadian Armed Forces and long-term care homes, to many other examples. But I know the health minister will be able to get you more details exactly on all the federal resources that we've already dispatched over the past year across the country. But as I said, we're always willing to do more. On your other question, before I turn to Minister Freeland, let me just say that the conversations I've had over 29 different First Ministers meetings since the beginning of this pandemic have been remarkable for the areas of alignment that we have seen. People understand right across the country that we need to do more for seniors, that childcare isn't just a moral argument anymore, it's also an economic argument, which it has always been, but is finally being recognized by the business community and by people across the political spectrum. That the need for support in our healthcare system has been never clearer than before, which is why the federal government has picked up the tabs for vaccines, why we have transferred billions of dollars to the provinces to support their healthcare systems through this crisis, and how we will continue to be there to work hand in hand with the provinces on the priorities of Canadians that, yes, indeed, we have laid out in the budget, but many of those priorities, if not all of them, are also things that we can see in provincial budgets and in provincial priority lists. There are lots of opportunities for us to roll up our sleeves and work extremely quickly on these big issues, and I'm looking forward to doing that with the provinces. Chrystia.
Thanks, Prime Minister. Hi, Tanda. Yes, I have had some conversations already with provinces and territories about early learning and childcare, and so has my colleague Ahmed Hussein, who is playing a central role in this work. I think before naming names, it's fair to give the provinces and territories a chance to see what we've laid out in black and white in our budget, the numbers we've put on the table. And then we really look forward to rolling up our sleeves and starting to negotiate bilateral deals with willing partners among the provinces and territories on really stepping up our game on early learning and childcare. Absolument. Oui, J'ai déjà eu des conversations
Yes, I have
avec
already
les
had
provinces et
a
territoires
conversation with
concernant les
provinces and territories with regards to
Et mon
childcare,
collègue Ahmed Hussein
and my colleague Ahmed
qui
Hussein,
joue un rôle
who
central dans
has
cet
a
effort,
central
a
role to
aussi eu
play
des
in this effort, has
conversations.
also had such
Maintenant,
conversations
on
now.
a publié nos
We
plans.
have
On a été
published
clair
our plans.
concernant nos
We were clear
ambitions.
with
Et
regards
aussi,
to
on
our
était clair
ambitions, and we were
sur
also clear
l'argent qu'on est prêt à
regarding the
dépenser
money we are
pour
ready
ce
to
système de
spend
garderie.
for this
Je
childcare
pense que
system.
c'est juste de permettre
I
aux
believe
provinces et
that it
territoires
is fair to allow
quelques
provinces
moments
and territories
pour lire ce qu'on
some
a
time
écrit,
to
pour
read what we've
penser
written
de ça.
and
Mais
to
au
think
niveau
about it.
fédéral, on est
At the
prêt
federal level, however, we are ready.
à commencer
We are
les
ready to
négociations
begin
bilatérales
negotiations
concernant
bilaterally
les garderies. Et
with
je suis
regards
optimiste
to
que
childcare, and I'm
on
optimistic.
trouvera des
I believe that
partenaires
we will
qui
find
partagent nos
partners
ambitions
that share
dans
our
ce secteur.
ambitions in this sector.
Thank you. We'll take one last question on the phone.
Thank you. Merci. The next question. La prochaine question est de Catherine Lévesque de la presse canadienne.
Catherine
La parole est à
Lévesque,
vous.
Canadian Press.
Oui, bonjour
Question.
Mme Freeland, bonjour Monsieur Trudeau. Monsieur
Good
Trudeau, je voulais
afternoon.
juste revenir
Mr.
sur les
Trudeau, I would like to
garderies et
come
les
back
commentaires
to
que vous avez faits à
childcare,
mon
the comments
collègue
you made
Raymond
to my
Fillon. Quand
colleague
vous
Raymond
dites que le
Fillon.
Québec aura droit à
When
sa
you said that
juste
Quebec will
part
get
de
its
30
just
milliards de
part
dollars,
of
est-ce
this
qu'on en
$30
comprend que ce
billion
sera
envelope,
au prorata,
will
donc
this be
que Québec aura
prorated?
environ
Will
6
Quebec
milliards de
receive
dollars?
about $6 billion
Et
of the
aussi,
30?
sur les conditions, vous dites que les
With
ententes
regards to
précédentes
conditions, you said that previous
spécifiaient que cet
agreements
argent devait aller aux
came with
familles et aux
conditions saying
enfants,
that the
donc
money
j'en
must be
comprends qu'il y
earmarked for
aurait
families and
des
kids. So I understand
conditions,
that there
du
will
moins
be
certaines conditions rattachées à ça.
similar
Est-ce que vous
conditions
n'êtes pas en train
attached
de
to
vous
this
magasiner
funding.
une chicane avec Québec?
Are you preparing for a tussle
Au
with Quebec?
contraire, toutes les
Answer.
conversations qu'on a
Quite the
eues
contrary.
déjà,
All the
et
conversations we've
Mme
had
Freeland
up to
peut
now, and
s'en
Ms.
parler,
Freeland could talk to you a
avec
bit
le
more
Québec ont
about it,
été
with Quebec,
extrêmement
have
positifs,
been
même
very
avec
positive.
la situation de leadership que le Québec a depuis
Even
longtemps
with
en
regards to,
matière de garderie.
especially with regards to the fact that Quebec has been a leader in childcare, but
mais
even
ils ont
so,
tellement
they could do
d'avance
with even more
sur les autres
resources.
provinces
They
qu'on ne s'attend pas du tout
are so far in the lead with regards to childcare, so we don't
de
expect
ça aille seulement dans les garderies.
every
Il y a
cent
aussi
to go
d'autres
directly
besoins
into
pour les
childcare
familles
because there are other
québécoises qui sont là.
needs for Quebec families.
Je réitère
I would like
notre
to
ouverture, notre
reiterate
flexibilité
our
et notre
openness, our
reconnaissance
flexibility, and
envers le
our
gouvernement du
gratefulness
Québec
to
et
the
plusieurs
Quebec
gouvernements
government
du Québec au fil des
and
années
various Quebec
qui
governments over the
ont
years
démontré ce
that have
leadership.
shown
Et je
this
sais
leadership, and
en
I know
conversation directe
that
avec
in a direct
la
conversation
province
with
dans
the
les
province of
jours et
Quebec
semaines à
in the
venir,
days and
on
weeks
va
to come,
pouvoir s'entendre.
we will be able to
Notre
find
but,
an
c'est
agreement.
d'assurer
Our
que
aim
les
is
familles
to
ont les
ensure
ressources
that
nécessaires
families
pour
have the
pouvoir
resources
réussir.
they
Et
need
je
to
sais que
succeed.
c'est un grand but pour le
And
Québec
this is a
aussi.
great objective for
Chrystia?
Quebec. Perhaps Ms. Freeland has something to add.
J'ajouterais, évidemment, je suis d'accord avec le Premier ministre, j'ajouterai
Evidently,
seulement
I agree
que
with the Prime Minister.
c'est
I
une
would
bonne nouvelle pour
add
le Québec.
also that
Parce
this is
que
good news
le
for Quebec
a fait
because
ça
Quebec
sans vraiment appui du
moved
côté fédéral.
forward without
Maintenant,
federal support in
le
the past.
fédéral
Now,
sera
the
là
federal government
aussi.
is stepping up.
C'est pour le Québec de répondre,
It's now
mais je
Quebec's
suis
turn
vraiment
to answer.
optimiste
But I'm
parce
very
que,
optimistic.
c'est le Québec qui sera le
I'm
modèle
optimistic
pour
because
le
Quebec
reste
will be
du
a
Canada.
model to follow for the rest of Canada.
Merci. On va maintenant passer au plancher. Première question. David?
Pardon, j'ai pas eu de suivi.
Pardon, Catherine,
I
on suivi.
didn't get a
Désolée.
follow-up.
My bad. Vas-y.
Merci beaucoup. Oui.
Question.
Donc, voilà, si vous pouviez juste en fait, répondre là, à savoir si la juste part
Could
du
you
Québec, en fait, ça
tell us if
représente
this
le
just part
prorata.
will be
Et j'ai une autre
prorated?
question sur les restrictions
I have
de
another question
voyage.
on
Donc,
travel
on comprend que ce
restrictions as
sera
well.
là,
We
dans
understand
le fait que les transporteurs
the
aériens
fact
ne
that
permettront pas d'aller dans
air
le sud, ça
carriers
se
will
prolonger
not be
d'un
able
mois.
to go
Par
to
contre,
Sunshine
on
destinations will
constate
be
que
prolonged
vous n'avez pas
by
nommé
a month.
Transat
But
ni
you didn't
Sunwing.
mention
Je me
Sunwing
demandais
or Air
s'ils
Transat.
n'avaient pas accepté de prolonger
Have
ces
they not
mesures-là.
accepted to
Et
prolong
pourquoi?
these
Est-ce qu'on peut
measures?
s'attendre peut-être à
If
une
so,
entente
why?
sous peu là, avec ces deux autres
And if so, can
compagnies à ce
we
sujet?
expect an agreement with these two companies?
Comme vous savez, Catherine,
Answer.
il y a
Well,
plusieurs
as you know,
mois, tous
Catherine,
les transporteurs
a number of months ago,
aériens
all
au
air
Canada
carriers
ont
in
annoncé
Canada
qu'ils allaient
announced
suspendre
that
jusqu'au
they
1er
would
mai.
suspend
Il
such
reste
flights
encore
until the
quelques
1st of May.
semaines à
There's
ce
still a
niveau-là
few
et je suis
weeks
certain que des
to go,
discussions
and
se
I'm sure
poursuivent.
that discussions are continuing now.
Hi, Prime Minister. Your budget puts a considerable amount of money for childcare on the table. I'd like to know, will provinces, in rolling out their childcare plans, will they have to put extra money on the table as well If so, how much?
The arrangement with each province and territory is going to depend on the bilateral negotiation, and it will vary from province and territory. We've just heard a lot of questions about Quebec, and people have pointed out rightly that Quebec already has an extensive system of affordable early learning and childcare, and there's huge variety across the country. So each bilateral negotiation is going to be different, and each relationship is going to be different, and we're going to actually negotiate. You know, we understand that this is work being done directly by the provinces and territories, and I think it's going to be important for us to listen and to hear from them where they see the needs. And we're sincere about really wanting to roll up our sleeves and work together and understand province by province, territory by territory, what is needed. Having said that, let me also say our goals, although Canada is very, very diverse in the provision of early learning and childcare and pretty much everything else, our goals are now national. And what we're saying is every Canadian parent, 5 years from now, everywhere in the country, should have access to affordable, high-quality early learning and childcare for an average of $10 a day.
Thank you.
Prime Minister, you were asked this morning, but I was waiting for a little more clarity on this. Anyone over the age of 40 in Ontario is now eligible to go to a pharmacy and get the AstraZeneca shot. That's you. Will you do that? And once you're vaccinated, do you plan to attend the G7 in the UK in June, which looks like other leaders are going to attend? Are you going to be there, or are you going to Zoom in?
My intention has been, as I've said many times, to get vaccinated as quickly as my turn comes up. With the news that AstraZeneca is now available for 40 and up in Ontario, my office and I are busy trying to book appointments, and we will be sure to invite everyone along to help encourage others to get vaccinated as quickly as possible. I'm looking forward to that happening, and we'll let you know as soon as we've concretized the plans for that. In regards to the G7 in June, I'm certainly hopeful that we'll be able to attend in person. I know there are continuing to be restrictions and concerns, but as we get closer to June, hopefully it'll become clear that I will be able to attend in person. But we're going to make a final decision when the time comes. D'abord, comme je dis depuis longtemps, j'ai très hâte de me faire vacciner.
For a long time, I look forward to being vaccinated. I've always said that the second my age group is open to vaccination, I will be vaccinated. We are currently in the process
d'arranger un rendez-vous
dans une pharmacie pour avoir an appointment in a pharmacy to get my first dose. Probably AstraZeneca. I hope AstraZeneca, to encourage everyone to do the same. And when we have more confirmations, we will let you know so that we can convey the message to all Canadians so that they can be vaccinated with the first one that is offered to them as rapidly as possible. Second of all, with regards to the G7, which will happen in the United Kingdom, I hope I will be able to go in person, but of course we will follow public health guidelines here in Canada, and we will do everything that is necessary to make sure that everyone is safe.
Bonjour, Louis Blouin de Radio-Canada.
Monsieur
Trudeau, Madame Freeland, sentez-vous libre de répondre les deux? Comment pouvez-vous justifier d'imposer un système pan-canadien de services de garde quand au même moment, il n'y a rien là-dedans pour les transferts en santé pour les provinces? C'est une critique qu'on a entendue depuis hier. Pourquoi ne pas aller là? Pourquoi ne pas essayer d'avoir fait un geste dans ce sens-là alors que c'est ça que les provinces vous demandent? Ils nous disent notre système de santé a de la difficulté, on n'est pas capable d'avancer. Pourquoi pas être allé là?
D'abord, on est allé là, Louis.
Louis, we have gone in that direction for months and months now. We have been transferring billions upon billions of dollars to provinces and territories to help their healthcare system. With, in this budget, an extra $4 billion envelope that will be directly invested in the healthcare system with $1 extra billion for vaccinations. We have signed a $19 billion agreement. We have undertaken transfers, we're paying for vaccines, we are supporting provinces
pour ce moment de crise, parce
for this, to get through this crisis, because we know that the needs are huge right now. These are additional needs to the usual load, which makes the workload very heavy for provinces. So we are here, and we have stepped up since the beginning of this crisis, and we will continue to support provinces and the Canadian healthcare system as a whole. What I have always said is that in this pandemic, we have learned many things about Canada and about the weak links in our system, and we recognize, yes, that it will take a greater investment and greater transfers from the federal government to provinces with regards to healthcare, and that's why we had such a meeting on the matter in December. What I have always said, however, is that while, yes, we are here to help in the moment with all tools necessary to fight this crisis, we will wait for things to settle down just slightly once we have weathered this pandemic storm, in order to then negotiate what the transfer landscape will look like in the future and for the long term. We are in a very acute situation right now where acute investments are made to allow the economy and Canadians to recover. That is our priority. But I look forward to continue our partnership with provinces with regards to healthcare investments, and we will increase healthcare transfers in the long term once that we have weathered this pandemic storm.
We have been investing directly billions of dollars in supporting healthcare systems across the country. From the $4 billion recently announced as part of this budget for general transfers to healthcare, to an extra $1 billion for the vaccine rollouts, to a $19 billion agreement last fall that is there to support the provinces, including lots for health systems, to paying for vaccines, to working hand in hand on the rollout. We have been there to support provinces and territories in the extra costs they're facing because of this pandemic on healthcare. We made a promise to have Canadians' backs, and that's exactly what we're doing, including by transferring billions of dollars to the provinces to help with their healthcare systems. At the same time, we recognize the weaknesses and the gaps that have been displayed by this pandemic, particularly in areas like long-term care for seniors, that are going to require all of us to continue to step up. There have been surgeries put off. There have been extra costs on the provinces that we know need more stability going forward. So we have committed that we will increase transfers to the provinces, recurring and long-term. But the decision about how much and how to exactly do that, we have decided needed to wait until we're through the worst of this crisis. We are there to support Canadians through the provinces with massive transfers right now in this crisis on healthcare, and we look forward to discussions about how we can make more investments for the long term. But our priority right now is getting through this pandemic first, and that's exactly what we're going to do.
You can go ahead, man.
Okay. Hello, Mr. Trudeau. Man Hamidi with the Canadian Press. Your government has been blamed for not implementing quarantine rules earlier and allowing variants of concern to flourish in Canada. Why are we still allowing flights from countries with high rates of COVID-19 and variants of concern such as Brazil and India to fly into Canada?
Well, allow me to correct the record a little bit. From the very beginning, from March 2020, over a year ago now, we brought in some of the toughest and most stringent travel restrictions of any of our peer countries around the world. From last March onwards, a mandatory 2-week quarantine has been in place for anyone arriving in Canada. And that is something that has been extremely effective in limiting the importation and therefore the spread of COVID-19. However, as we saw the emergence of variants around the turning of the new year, we increased significantly our restrictions at the borders, demanding, for example, a pre-departure PCR test to demonstrate that the travelers are negative for COVID when they get on the plane to come back to Canada. On top of that, as time rolled on, we added even more measures. It is now mandatory to get a testing on arrival as well. There is quarantine for 2 or 3 days while you wait for that test result in government-approved accommodations for air travelers, and everyone does follow-up tests while they quarantine in with an approved quarantine plan once they arrive. We have been very firm and vigilant on these measures, but of course, as I always say, we are continuing to look at more, and I have asked our officials to look carefully at, for example, what the UK has done very recently on suspending flights from India, what more can and should be done to ensure that we are not getting cases in from overseas. The measures that we have put in place are limiting significantly and severely the importation of travel-related cases, but we will continue to look at the best science and the best measures that we can do to make sure that the borders continue to be a protection against spread of variants and COVID-19 inside of Canada.
Thank you. Next question.
Hi, Prime Minister Trudeau and Deputy Prime Minister Freeland. Thank you for taking our questions today. I wanted to ask you about military sexual misconduct. It was mentioned in the budget. We're now 2.5 months past when the story broke. We still don't have any details about what the probe into this is going to look like, or whether the watchdog mentioned in the budget will be reporting to Parliament, but Liberal MPs did shut down the committee that was investigating this. I'm wondering if you're concerned about the message that sends to the victims of sexual misconduct, that there hasn't been action yet, and if you can give us any kind of a timeline or a benchmark for action on this.
The message is very clear. No one should ever face harassment, intimidation, or assault while serving in the military or in any other job across this country. The women and men who stepped up to serve their country deserve better than they have received in terms of protections and support over the past many decades. Over the past 5 years, we have taken significant measures to improve the processes, but it has become very, very clear that they are inadequate, that the culture change has not happened fast enough, that there are not yet the right supports for people who come forward with allegations and heart-wrenching stories of abuse and intimidation. We are taking this extremely seriously. Processes are in place to stand up new measures and new approaches. We recognize that the time is not just for discussion, the time is for action, and that is exactly what we are moving forward on, why the committee independently decided to move forward with moving on its report and getting action going. But as also was mentioned, there are measures in the budget that directly target that, and I will turn to Minister Freeland to further expound on it.
Yeah, thank you for the question, Mercedes. And, just to say, we did put that in the budget because we recognize how urgent the challenge is. It's very important for our government that all Canadians, no matter where they work, need to be safe from and free of sexual assault and sexual harassment. And that is going to be a priority for our government. And, we are putting in place really important measures to make sure that that's the case.
Une dernière question au plancher.
suivi sur le projet de loi 21 ce matin, sur la loi 21 en fait, il y a un tribunal qui l'a maintenu, suspendu certains articles quant au cégep anglophone des élus de l'Assemblée nationale. J'aimerais avoir votre réaction. Est-ce que vous voyez une porte ouverte s'il y a appel ou une intervention du fédéral? Qu'est-ce que vous pouvez nous dire?
Écoutez, on a vu qu'il y a eu une décision qui a été rendue aujourd'hui. Je n'ai pas eu le temps de la regarder en détail, mais on reconnaît qu'il y a un processus judiciaire en cours et nous allons continuer de suivre attentivement ce processus qui sont en cours. Écoutez, on n'est pas là. On va regarder le processus qui se déroule comme il se doit.
Merci beaucoup. C'est ce qui met fin à la conférence de presse aujourd'hui.